Actually expected it because the budget committee has for a few months been thinking about significant cuts to the tune of hundreds of billions of dollars. So the budget options document that started circulating a couple of months ago did actually lay out what could be like really significant cuts to federal Medicaid funding. And I will say that it doesn't look like we thought that work requirements probably still are a hot topic and have been. The way ACAP has been looking at this is there's been this long list of options, all of which could have a significant impact. The various combinations of those proposals, all of them or some subset, could have a significant impact on how Medicaid works going forward.
I think there are 12 states, as you may know, that have trigger laws, right? Essentially, so where the federal Medicaid assistance payment amount, which is currently set at 90% for expansion enrollees, where that is reduced or is eliminated, then 12 states have trigger laws that automatically end expansion or require changes if that federal match were to drop. And so states would have to then come up with a way to, create revenue for Medicaid programs, or they would end expansion altogether, which would obviously increase the number of uninsured adults in particular. They could also, again, this is not an area of expertise for me, but states could sort of reduce the types of covered benefits within their respective state Medicaid programs. And so all of that, like I mentioned earlier, all of that has a downstream impact on healthcare providers, and particularly hospitals and primary care providers that rely on Medicaid as a source of reimbursement for the services that they furnish. And at some point, those, if those services are not reimbursed or not reimbursable, then you start to see, provider closures or providers just being unwilling to accept Medicaid, or Medicaid patients not being able to find, healthcare in a meaningful way.
We are doing a lot of different things. First, we're working with a whole bunch of allies, right? We're talking to people on both sides of the aisle on a Hill. We're trying to figure out what the actual proposals will be in an eventual budget reconciliation package, gather intel, let them know what we think about the Medicaid program. We're engaging in a ton of education about what Medicaid really means, right? There's the stereotype of what it means, and then here's the actuality of what this means to your district, to your community. We, as you know, represent 84 safety net health plans, and those health plans are partnering with us in messaging to their own delegations about the importance of the Medicaid program. So that's a big part of what we're doing. We're working with our own health plan members to get out on the Hill. We had a fly-in 3 weeks ago, and lots of our plans were all over Capitol Hill in person, plus making phone calls from their home districts. We are working with the communications folks at our plans to place op-eds around the country and local publications such that they reach the people who are working in district offices as well about the importance of Medicaid to the communities. And yeah, we're working with a lot of allied coalitions to coordinate, to explore what additional research and evidence needs to be established and shared to make the point that Medicaid is very important. We're using all of the tools in the advocacy toolkit. That's how we say it. We're trying to do everything that we can to spread the importance of the program.